Camaraderie Health Agency understanding Medicare enrollment periods. Medicare have different times of the year that you can enroll in a plan. Medicare Initial Enrollment Period, IEP. Medicare is health insurance for people 65 or older. This is called your initial enrollment period. It lasts for 7 months, starting 3 months before you turn 65, and ending 3 months after the month you turn 65. Note: you may be eligible to get Medicare earlier if you have a disability, end-stage renal disease, ESRD, or ALS, also called Lou Gehrig's disease. What can you do? Sign up for a Medicare Advantage plan, with or without prescription drug, MAPD or MA, or a Medicare prescription drug plan PDP only. Example: your birthday is June 1st. When you turn 65, your initial enrollment period is February through August. If you sign up in February, March, or April, your coverage starts May 1st. Annual Enrollment Period, AEP, Open Enrollment Period for Medicare Advantage and Medicare drug coverage. What can you do? Change from original Medicare to a Medicare Advantage plan. Change from a Medicare Advantage plan back to original Medicare. Switch from one Medicare Advantage plan to another Medicare Advantage plan. Switch from a Medicare Advantage plan that doesn't offer drug coverage to a Medicare Advantage plan that offers drug coverage. Join a Medicare drug plan. Example: you enroll November 1st, from one Medicare Advantage, MA, plan to another MA plan. Your coverage starts January 1st. You will be automatically disenrolled from your current plan after the end of December. Medicare Advantage Open Enrollment Period, MA, OEP, what can you do? During this time, if you're in a Medicare Advantage plan and want to change your health plan, you can do one of these. Switch to a different Medicare Advantage plan with or without drug coverage. Go back to original Medicare and, if needed, also join a Medicare prescription drug plan. Cannot enroll into MA if currently not in one. When? January 1st through March 31st. Effective? First day of the month after your new plan gets your request for coverage. Example: if you enroll in a new Medicare Advantage, MA, plan on January 15th, switching from your current MA plan, your coverage with the new plan will typically begin on February 1st. This means you will be automatically disenrolled from your old plan at the end of January. General Enrollment Period. What can you do? You can sign up between January 1st to March 31st each year. This is called the General Enrollment Period. When? Your coverage starts the month after you sign up. You might pay a monthly late enrollment penalty if you don't qualify for a special enrollment period. SEP Move. You change where you live. I moved to a new address which is not in my plan's service area. What can you do? If you tell your plan before you move, your chance to switch plans begins the month before the month you move and continues for 2 full months after you move. If you tell your plan after you move, your chance to switch plans begins the month you tell your plan, plus 2 more full months. Note: if you're in a Medicare Advantage, MA, plan and you move outside your plan's service area, you can also choose to return to original Medicare. If you don't enroll in a new MA plan during the time explained above, you'll be enrolled in original Medicare when you're disenrolled from your old Medicare Advantage plan. Special Enrollment Period Institution. I just moved into, currently live in, or just moved out of an institution, like a skilled nursing facility or long-term care hospital. What can you do? Join a Medicare Advantage plan or Medicare prescription drug plan. Switch from your current plan to another Medicare Advantage plan or Medicare prescription drug plan. Drop your Medicare Advantage plan and return to original Medicare. Drop your Medicare prescription drug coverage. When? Your chance to join, switch, or drop coverage lasts as long as you live in the institution and for 2 full months after the month you leave the institution. SEP Institution. I am released from jail. What can you do? Join a Medicare Advantage plan or Medicare prescription drug plan. When? Your chance to join lasts for 2 full months after the month you're released from jail. 5-star special enrollment period. What can you do? If a Medicare Advantage plan, Medicare drug plan, or Medicare cost plan with a 5-star rating is available in your area, you can use the 5-star special enrollment period. To change plans? When? You can use this special enrollment period only once between December 8th and November 30th. SEP. You are eligible for both Medicare and Medicaid. What can you do? Switch Medicare prescription drug coverage or drop your Medicare Advantage plan with drug coverage and return to original Medicare by joining a standalone Medicare drug plan. When? One time during each of these periods. January through March, April through June, July through September. If you make a change, it will take effect on the first day of the following month. You'll have to wait for the next period to make another change. You can't use this special enrollment period from October to December. However, all people with Medicare can make changes to their coverage from October 15th to December 7th, and the changes will take effect on January 1st. SEP. You qualify for extra help paying for Medicare drug coverage. What can you do? Switch Medicare prescription drug coverage or drop your Medicare Advantage plan with drug coverage and return to original Medicare by joining a standalone Medicare drug plan. When? One time during each of these periods. January through March, April through June, July through September. If you make a change, it will take effect on the first day of the following month. You'll have to wait for the next period to make another change. You can't use this special enrollment period from October to December. However, all people with Medicare can make changes to their coverage from October 15th to December 7th, and the changes will take effect on January 1st. SEP. You are enrolled in a state pharmaceutical assistance program, SPAP, or lose SPAP eligibility. What can you do? Join either a Medicare drug plan or a Medicare Advantage plan with drug coverage. When? Once during the calendar year. Or if you lose SPAP eligibility, then your chance to switch starts either the month you lose eligibility or the month you're notified of the loss, whichever is earlier. It ends 2 months after either the month of the loss of eligibility or notification of the loss, whichever is later. SEP. Loss of coverage. What can you do? Join a Medicare Advantage plan or Medicare prescription drug coverage. Your chance to join lasts for 2 full months after the month your coverage ends. SEP. Trial Period 1. Join a Medicare Advantage the first time when turn 65 allows you after first 12 months switch to a Medigap policy plan. What can you do? Drop your Medicare Advantage plan and enroll in original Medicare. You'll have special rights to buy a Medigap policy with guarantee issue. When? Your chance to drop your Medicare Advantage plan lasts for 12 months after you join the Medicare Advantage plan for the first time. SEP. Trial Period 2. Dropped Medigap policy the first time to join a Medicare Advantage plan. What can you do? Drop your Medicare Advantage plan and enroll in original Medicare. You'll have special rights to buy a Medigap policy with guarantee issue. When? Your chance to drop your Medicare Advantage plan lasts for 12 months after you join the Medicare Advantage plan for the first time. SEP. Enrolled in Special Need Plan, SNP, and no longer qualify. What can you do? Join either a Medicare Advantage plan or a Medicare drug plan. When? Your chance to switch starts the month you lose your special needs status. It ends when you join another plan or 3 calendar months after you lose your coverage from the SNP, whichever is earlier. SEP. I have severe or disabling chronic condition and there is special need plan, SNP, is available. What can you do? Join a Medicare Chronic Care Special Needs Plan that serves people with my condition. When? You can join anytime, but once you join, your chance to make changes using this SEP ends. Thank you for watching the Medicare Babe series. We invite you to watch the next video in our series entitled Medicare Resources. You are invited to subscribe to Camaraderie Health Agency LLC YouTube channel.